Hey everyone, it's Lamar with the Healthcare Digital Marketing Podcast. I'm excited about bringing on Colin just to really showcase his digital marketing and marketing in general expertise. He's got a lot going on. You and I met through an email introduction, and really just love for you to kind of open up and tell the audience who you are, give some context of your background, but also 2 points I would love for you to talk about too is the company you currently work for, and then also your current podcast. So yeah, just tell us all about Colin.
Absolutely. Well, Lamar, thank you so much for having me today. Very excited to dive into our conversation. Basically, I run marketing for a comprehensive outpatient addiction treatment provider called Brightview. We have 40 plus locations in 4 states presently, about 10,000 patients under care.
Oh, wow.
And I have the opportunity to do some interesting sort of testing and scaling in real time, in the wild, so to speak, with direct to patient marketing, which is something that a lot of addiction treatment providers aren't doing. They
Yeah.
pursue the loved one, they pursue somebody that may have the financial means to pay for, a rehabilitation program. We primarily serve the Medicaid population. Our average patient age is 39. And so we're
Okay.
not going after the concerned loved one, so to speak. We're going after that patient directly. And so that provides like a really fresh, interesting environment for me to play test and scale what's
Oh, yeah.
working and what's not working. So I really enjoy that. As you mentioned, I also have the privilege of co-hosting Take Five, the Rethink Marketing podcast. We're on all major podcast platforms. We interview a lot of guests, so it's really great. Our audience gets to actually learn from good marketers and not just hear me ramble on, but have really enjoyed that, getting to know some of the best in the business and just providing great value and great learnings for me personally, and then obviously for our audience as well.
No, that's awesome. And so quick question on Brightview. I saw that they were ranked, or you guys were ranked top, place to work. Like, how did you do that with so many locations, so many, staff members, so many patients?
That's a great question. So I think the big thing is healthcare in general and behavioral health, addiction treatment specifically, attract a very passionate person. And so we don't have a lot of people who were looking for a job and stumbled into Brightview. We have a lot of people who either have lived experience, have a spouse or a parent or a sibling perhaps that struggled with addiction, that may be in active recovery. Many of the folks who work at Brightview are in active recovery themselves. A lot of the folks that answer the phones, we have peer recovery supporters that are in recovery. Some of the case managers or counselors, and
Okay.
even some of the physicians are in recovery long term. And so
Wow.
that level of passion means that
Yeah.
we show up, we go the extra mile, we serve patients in a way that I think in a lot of quote unquote JOBs, right? People
Yeah.
they don't really have that drive and that same level of buy-in and that same level of engagement. So that's definitely one reason. And then the other reason is I think you have to do a good job internally marketing your culture, if that makes sense.
Yeah.
Letting
Oh,
people
yeah.
know if you think we're the best because you work here, you don't want that cognitive dissonance of I work at this place, but I don't like what we're doing. You want somebody who's bought in, who's passionate, who really enjoys it. And
Right.
part of the way that we foster that is by doing a lot of internal marketing and letting people know, hey, are you doing a good job? Here's what are you, generally speaking, is Brightview doing good work? Are we doing a good job? What are patient outcomes? We
Yeah.
just released a big white paper probably about 2 months ago in June of 2021 that detailed patient outcomes. What does that mean for less jail time specifically? What does that mean for fewer arrests specifically? What does that
Wow.
mean for a higher, what we would consider like primary care doctor, dental, those types of regular healthcare appointments? What does that mean
Right.
specifically? And so now what we're able to do is look at county by county, the folks that we serve, and see the reduction in jail time, see the reduction in arrests, see the reduction in stress on the local emergency rooms. And that is powerful. And educating our staff on, hey, you're not just showing up to work and helping somebody feel better. You're showing up and you're helping change somebody's life. And
Right.
that correlates to the community as well, because now we're seeing, we're seeing jail times go down. We're seeing number of arrests go down. We're seeing
Wow.
engagement with healthcare providers go up. We're seeing, things like stress and anxiety decrease as well. So it's really, really fascinating to dive into that data and say, here's what we're doing from an anecdotal perspective, from a patient story
Right.
perspective. And then here's what we're doing from a data perspective. So I think that's really, really key in getting that buy-in and keeping people engaged. And to your point, to being one of the best places to work or top workplaces.
Yeah, I think that's amazing, and definitely sounds like you guys are making an impact. And I think you're positioning your mission and the impact that each individual person that works there can make on other people's lives is monumental. I think that's pretty awesome just to hear that you guys are developing a culture and fostering that that those relationships with inside of the business to really believe what they're doing is you're going to impact someone else's life, in that sense.
That's exactly right. And there's a difference between hearing the stories, those are extremely powerful, and
Yeah,
then complementing that with the actual data to back it up.
right,
Then you get into this quantitative, qualitative matrix that's just extremely potent because you're seeing the data and you're hearing the individual firsthand encounters to back it up. And
right.
that's what I love working at Brightview because of those two things. And I
That's
know my
awesome.
coworkers do as well.
That's awesome. So talk about what you do specifically. Like what does your day-to-day look like?
That's a great question. So my primary objective is to help people begin recovery. So I look to target folks who are in active addiction. Like I said, we primarily serve the Medicaid population, and that comes with lots of other issues, things like housing insecurity, transportation
Yeah,
insecurity, lack of employment, and so on and so forth. And so I'm not able to just say, oh, we're going to run radio spots and reach the people that we need. Well, generally, you
yeah.
listen to your radio when you are in your car driving to and
Right,
from your job. So if you don't have a car
right,
and you don't have a job, it's really difficult for you to engage with radio. Same thing
right,
with billboards, right? You drive past billboards in your car on your way to and from your job. You receive direct mail. You read magazines. You get marriage mail or co-op mail, whatever you want to call that. There's like group
right,
mails. You get those at your house regularly. And so if you're housing insecure, you're probably not receiving those. You generally watch Amazon Prime or Hulu or Tubi TV or what have you
right.
at your house or at your apartment. And so if you're housing insecure, you're probably not consuming that content. So my job is really to find folks where they are on the media that they're consuming when they're in active addiction with all of those other complications that often are correlated with addiction. And so part of that looks like search engine optimization, making sure that when folks are
Yeah,
ready to receive help, that Brightview is available above inpatient rehab that might require a plane flight, or above another provider that may not take their insurance, or if they're uninsured, that may not treat them at all because they're uninsured, and so on.
right.
It also looks like SEM because a lot of times folks are not feeling great. We know that 85% of clicks are going to the first organic listing, but
Right.
about 10% of clicks are going above that to the paid ads. And so we have to make sure that as folks are looking for the services that we offer, that they're finding us, especially on terms that are non-branded, that we
Yep.
don't rank well for, frankly. So that's
Right.
an element of our mix. We also look at geofencing, retargeting, YouTube targeted pre-roll to try to make sure that folks who are searching things similar and auxiliary to what we do are getting our content, are recognizing what we do, are when they're ready for help, they're reaching out to us. And then we also do a variety of things to just build awareness in the community. So we'll
Yeah.
sponsor events, we'll do direct mail when we first open a center, those types of things. But that's sort of what my day-to-day looks like.
Wow. Sounds very complex and entertaining and very impactful, all in one bucket. But I guess like when you think about marketing, really, taking that to the direct consumer, is there a marketing channel that you just noticed over time just performs the best? And why is that?
It's really difficult to say because SEO is such a catch-all,
Yeah.
right? When we think about retargeting, when we think about YouTube targeted pre-roll, when we think about even things like direct mail or billboards or radio, a lot of those skew to actually help SEO because you're building brand
Yeah.
recognition. And then when somebody's ready to look for your product or service or your business, they're doing an organic search. And so it overinflates SEO. So I would say looking at our data, search engine optimization, or especially non-branded organic search is absolutely crucial for patient volume. That's bolstered by the rest of the things that we do, but I don't think it's independently successful. There's a lot of
Sure.
codependence that occurs with the radio spots that we might do in a small market with a local radio station, with a direct mail campaign we might do to build awareness, with certainly our search engine marketing, our retargeting, and our geofencing. Those are all really important. And then all of the digital marketing elements that we provide are then supported in large part by our community partnerships. So we work with hospitals and healthcare systems, emergency rooms, urgent cares, homeless shelters, food banks, and so on and so forth, to make sure that when somebody's presenting with addiction or with a co-occurring disorder or an infection that might be the result of an addiction, that we're able to make sure that that person is sent to a place that takes their insurance, that can see them same day, that doesn't have a wait list, that understands how to do a proper assessment on their acuity and then respond accordingly, and so on. So lots of things at play. And we haven't even touched on the sort of consumerism of marketing that has really pushed Brightview to do some content collaborations and things of that nature to make sure that we're not straight SEO, we're not straight SEM, we're really getting in on the content, because a lot of times referral partners want to know about what you stand for. They want to know about what your philosophy is. Are you a harm reductionist? Are you punitive? Can people get kicked out of your program? If so, how long until they get back in? What happens if somebody doesn't have insurance? All of these questions that they have, and rightly so. You don't want to refer someone who's ready to get help, who wants to get help, to a program that they aren't eligible for because of insurance. You also don't want to refer somebody who's ready to get help, who wants to get help, to a program that they've recently been kicked out of and aren't allowed back into if it's a punitive program. So there are lots of knowledge pieces that need to coalesce in order for that referral partner to make the right recommendation for that patient, and in some cases actually schedule that patient.
Right. No, I think that's awesome. And, you know, when I think about just the overall, you're being very intentional with the messaging and the pain point that the patients are having, and connecting that information online. Because I think about with a lot of the doctors that we work with from a marketing standpoint, sometimes when, like, let's say we're introduced to a new physician, right? And they're doing blogging, or the previous marketing company did some blogging. It's like 500 words. And it's just like, you know, how to clean your teeth. And it's great, like, you know, great and everything, just to kind of get content up there. But I think being more strategic about what questions your patients are actually asking when they're calling in, or asking when they're in your actual practice, creating unique content around that, answering those questions. It just, you know, it brings more credibility to the practice. And then if those questions are common, you're going to be the resource that these patients, you know, come to when they're searching these questions in Google. So to your point, it's just more of a strategic approach with your referral partners, with the information you're putting online, and how you connect with the patient's pain points. And then I will say, like, it sounds like you guys just do a more comprehensive, you have a more of a comprehensive marketing solution, which is important, because when you think about branding, a lot of these marketing channels may not convert as well, but if you're branded in a way where they can see you, right? And then when the pain point is connected and they're ready to, you know, buy or take action, they're going to remember that brand, right? And then when they go to Google and they search your name and they see your reviews, you have a positive, you know, reviews from your existing patients. It just helps with the conversions of getting them to actually come to your practice. So I think what you guys are doing is pretty awesome. I still have like a conspiracy with Google sometimes, though. It's like, when you run Google ads, they favor those businesses that pay them, right? Like, pay them for their ad traffic, essentially. And so sometimes we'll see where, like, we're trying to rank doctors for neighboring cities for a specific term, and they have no business ranking for that term. But then we turn on Google ads for that term in that location, and then now their SEO is in a better position for that keyword, as I'm sure you know.
Yeah, I'm not saying that Google AdWords and the organic algorithm interact with each other at all, but there is a little bit of correlation there that might require some investigation. We'll just leave it at that.
Right.
And in our business, you have to be legit script certified in order to use AdWords. So there's this sort of added layer that delays any sort of SEM that you want to do.
Right. Yeah. I'm sure in your industry, it's you got to be tight knit on your verbiage, the information you put on your ad copy to make sure that you get approval to run those ads, for sure. So Colin, let's talk about just overall collaboration, because sometimes I think with marketing, that is a missed art. So when you think about collaborating in the healthcare space as a marketer, what are your thoughts on that? Any tips in terms of just collaboration?
Absolutely. So I love this concept of collaboration, especially in healthcare, because really, if we as healthcare marketers could get more people of the general population to engage with preventative health, that would be a win for everyone. And there are plenty of people who are totally ignoring preventative health.
Yeah.
And there, hospitals and healthcare systems could increase patient volume and increase revenue just by having a small percentage of folks increase their preventative healthcare.
Right.
And I look at that very similar in addiction treatment. The estimate by SAMHSA is that essentially, I think 20% or less of folks who have a substance use disorder will actually seek help for that, which means there's an 80% non-penetration rate for
Right.
folks who have the disease that we treat at Brightview. So if I can get patients to recognize, or if I can get people who are in active addiction to recognize, hey, I need help, I'm ready to get help, I want to get help, let
Right.
me start at Brightview, and then they go somewhere else. That's not that big of a deal from my perspective, because we can sort of keep filling that funnel, if that makes sense, with people who are in active addiction who want to get help. And if we as treatment providers, whether you're inpatient or outpatient only, whether you
Right.
are residential, whether you're detox only, whatever your philosophy is, there are so many patients to go around. We have a 20% penetration rate. If we could get that up to 50%, if we could get that
Oh
up to
yeah.
even 30%, then there are plenty of patients to go around, so to speak. So I love the concept of collaborating with other providers. We're working right now with an inpatient only, Brightview is outpatient
Okay.
only center, to create content around when do you go to an inpatient center, when do you go to an outpatient program? Because if I,
Oh, that's
as an
smart.
outpatient only provider, if I say you should go to outpatient and here's why, that
Yeah.
comes across as being biased. It seems like I have an ulterior motive. But if it's an inpatient provider saying, hey, inpatient's not the answer for everyone, sometimes outpatient is better. And then you
Right.
have Brightview as an outpatient only provider saying, hey, sometimes outpatient is not the end all be all. Sometimes you have to use inpatient. Here's why. Here's how you look at
Yeah.
acuity. Here's how you look at insurance, wait list, all that stuff, right? So that's a piece of content that I'm very excited about. We're talking about some other pieces of content with them, depending on how the collaboration goes. We're collaborating with recovery housing. That's something that Brightview doesn't do, at least not right now. And so helping
Yeah.
people understand we have these social determinants of health, things like employment, housing, whether or not you have safe and secure housing. So that's something that we're talking about with this housing provider, because again, it's interesting for us to say, here's how you can select an optimal housing partner, and
Right.
then for sober living, and then for them to say, here's how you can partner with or ally with a comprehensive outpatient addiction treatment program that is engaged with sober living and recovery housing. So some pieces of content like that, looking at other folks who serve the same patients that you do or similar patients that you do, I think is
Right.
key. The other thing is just looking at folks who have done what you want to do. So we've worked
Mm.
with a gentleman in California. His name's Sober Sammy. He has a huge following on TikTok, and he does a great job of bringing levity and bringing humor to
Yeah.
the complex, convoluted, and emotionally challenging topic of addiction and recovery. And so
Wow.
he's built a great audience of folks in recovery and of supporters of the recovery community, parents of folks in recovery and so on and so forth, where we're looking at him and thinking, okay, how did he do that? He brings humor as a brand. Can we leverage humor? And if not, how can we partner with him to bring that into the conversation? And then how can
Right.
we, as a sort of serious brand, help bring a little bit more gravitas to the messages that he's providing to his community? So we've done some collaborations with him, and he brings a unique perspective because he's able
Yeah.
to say, hey, when I was in active addiction, here's what I did, here's what I thought, here's what reached out, here's what spoke to me, here's who reached out to me, those types of things. And so learning from him and then learning from his audience, folks who are in that recovery community, to
Right.
replicate that in the markets that we serve. So yeah, I think there's so much opportunity here for marketers. And let's be honest, content is king. It doesn't matter if it's
Yeah.
YouTube videos, if it's TikTok videos, if it's Instagram posts, if it's videos on LinkedIn, if it's blogs on your website. Google wants content. The
Oh, yeah.
algorithms that choose how you rank on LinkedIn, on TikTok, on Instagram, they want good, fresh, original content. And an
Right.
easy and simple way to give that to them is to collaborate with other thought leaders or just other folks in your space. We found that to be true, and it's really helped us grow our organic followings online and our organic web traffic, which I think is the object. Like if I could do
Yeah,
that
that's
every
the
day as a
goal.
marketer, I'm crushing it. Exactly.
Right. So how much what's the impact of how much time do you spend trying to collaborate with influencers? Like the gentleman you mentioned in California. Would love to, help the audience understand. You gave the importance of it, but just love to understand like how frequent are those conversations happening with a company like yours?
Well, Lamar, I'm about to gain a lot of respect from some of your listeners, and I'm about to lose a lot of respect from others of them. But Yoda has a quote in Star Wars. He says, "Do or do not. There is no try." And so
Yeah.
my team spends very little time trying to collaborate with other content providers, and we spend a decent amount of time actually collaborating with them, if that makes sense. And so what that looks
Okay.
like is we'll reach out to 5, 10, 15, maybe other providers, and see, hey, are you interested in collaborating? And if they're lukewarm or if they don't respond, we don't bother following up with them. If they're passionate about it, if they're really interested, then we'll start
Yeah.
collaborating on some content. I have the opportunity to meet folks in our space, either virtually or in person. And so sometimes
Right.
we'll have a brief conversation about, okay, here's your area of expertise. It's recovery housing, let's say. My area of expertise is outpatient addiction treatment. Let's talk about some content ideas, some concepts that we might be able to collaborate on, and then let's see what the next steps are. And then we'll actually
Yeah.
start walking down that path versus 3 or 4 or 5 meetings about, well, let's throw some stuff against the wall and see what sticks. Let's create a content calendar, right? We get to it honestly and throw some content out there, see how it
Yeah.
performs, see how we can optimize, and then keep adjusting and iterating from there.
Yeah, I think that's very creative and smart, because I think with those type of collaborations, you can both take data that most people are not going to find online, and then you could, collaborate and mix that data together where it makes sense to whatever that topic is about. And Google's going to your point, it's going to be unique, fresh content where it's data driven, with facts, right? Because a lot of times with content, people are just like stealing information from other blogs or other sites, and it's just like you're saying the same thing as the other ones, just a different way. So I think that's pretty smart in terms of the way you collaborate, but being very intentional and making it effective for the audience that you're trying to get in front of.
Well, and Lamar, let me let you in on, and I say you in the general sense, let me let your audience in on a little industry secret. All right, don't tell anybody here, but that is a great way to build backlinks. If you want a
Yep.
strong backlink profile, collaborate with other people that also want a strong backlink profile. You would be surprised at the number of backlinks that we get. I shouldn't say surprised, right? When you collaborate with someone else, they want to link to your content and their content. You obviously want to link to that shared content as well. It's a great strategy in a
Right.
lot of regards, but backlinks are definitely one benefit.
Yeah, I agree. And if anyone doesn't know what a backlink is, it's really just getting your content and your website mentioned on another website. So if someone's reading, let's say, Johnny's website.com, they see your content, and may, be somewhere in the content, Colin is the author of this book. Click here to find his book. And if you click the text, click here, it'll take you to his book. And so that's a backlink. But what Colin is also saying is, because what you see, and I'm sure you see this all the time, people are always trying to buy backlinks, or they're trying to game the system. And Google's algorithm is just too smart at this point. It will penalize you in real time. And so I think it's so smart with what you guys are doing. You're building natural and unique content that people can't find anywhere else. And then guess what? Other websites are going to eventually find it, and they're going to mention it in their article. And so that's just going to, bring the value of your practice and your website up in the search results. So I think that's genius. More people should be thinking about it the way you're thinking about it.
I appreciate that.
Yeah, absolutely. So you talked about direct mail, radio, and we get this a lot in the medical space. Really, just traditional marketing, in a sense, it's it still has its place, right? But it's still it's the old age, it's the old, the marketing strategies that people used to do, like the yellow books years ago. Now most people are on their smartphones. Most people are, they're moving 100 miles an hour, so they're looking online on a laptop or a smartphone and so forth. So I know you have a controversial stance on traditional marketing, but what's your take, just how you guys use it, and is it effective or not?
That's a very challenging question to answer, simply because the patient population that we serve is much different than the sort of traditional archetypical healthcare decision maker, if that makes sense.
Yeah.
So let me give you just a quick example. I was talking to a patient at Brightview about the impact that his recovery had on his personal life. This gentleman was in his late 20s, so call it 28, 29, let's say. He lived in a rural county in Ohio, and we just had a really good conversation. When he was ready to get help, he decided he did a Google search for, outpatient rehab near me or something of that nature, found Brightview, read some of our literature. The staff treated him extremely well, and he started to feel better, came back, and so on and so forth. Now he was like 18 or 20 months in recovery. Just great story, excellent success story. Love to hear this from patients. Now, converse, let's flip that a little bit and think about the typical healthcare decision maker in a household is a female, generally ages, call it 35 to 50.
Okay.
She is generally making healthcare decisions for aging parents, for kids if they're getting injured or they're getting sick. A lot of times she's making healthcare decisions for her husband, if she's married, right? And she's making healthcare decisions for herself. So when you are a healthcare system or a hospital, you want to target that high income earner, healthcare decision maker, right? And there's so much data on what she's consuming. Is she on her phone? If so, what apps is she using? What websites is she visiting? What social media sites is she perusing? What social media apps does she have downloaded? And so on, right? What does that content consumption profile look like? Versus our patient population, where their content consumption profile is very, very limited. We know, based on patient interviews, on focus groups, on survey results with actual patients of Brightview, that they're not spending time on user subsites like Reddit or Imager or 9gag or what have you. So, okay, well, we can't advertise there. We know that they're really not spending a lot of time on social media apps outside of Facebook. So, okay, we can't really advertise on Instagram or Twitter or TikTok or what have you, right? So those are kind of off the table. We know they're not spending time watching streaming services. So we can't advertise I know you can't advertise on like Netflix, but say, okay, what will we, Amazon Prime's off the table, Hulu's off the table, Crunchyroll's off the table, Tubi TV, all of those streaming services off the table.
Right.
Versus, so for us, it's a lot more challenging because we then have to turn to, well, where can we reach people? If we're trying to build an audience and we know that I have somebody who's in active addiction sleeping on my couch because they're in between places where they can sleep, and I get a direct mailer that says, hey, Brightview is now open in your neighborhood and we accept Medicaid and we do all of these things, no wait list, medication same day, all that stuff. Then all of a sudden I'm like, oh, maybe this would be good for this person to see, and I can give that to them. Versus if we're advertising on a streaming channel, it may not be something that person's consuming. So we've had to get scrappy and kind of think outside the box, or think inside the box, depending on how you look at it. But there aren't billions of dollars being spent every year on the psychographic makeup and the media consumption habits and how to reach someone in active addiction, because their credit score is really low. They have, a lot of them have no income. A lot of the patients that we serve are on Medicaid, and so they're less attractive from a financial perspective to those large hospital and healthcare systems versus the sort of archetypical healthcare decision maker. So from my perspective, I think healthcare marketing is moving in the consumerism direction. So that means brand building, reputation management, content collaborations, things of that nature are growing in importance. And direct response marketing is simply decreasing in reliability and importance exponentially. For us, that looks a lot more like using some traditional routes. Now, I don't want to give your audience the impression that we're doing monthly direct mail drops and buying billboards every 4-week rotation or anything of that nature, because that's certainly not the case. I recognize the best thing to do with a direct mail drop is to build awareness. Once that awareness has been built, we're not doing direct mail drops because the objective is not to drive immediate conversions with direct mail, right? It's to raise awareness. And same thing with radio advertising, right? You don't do radio advertising because you want people to come in and have colonoscopies, or come in and have mammograms, or come in and have their broken legs set appropriately, right? You run those to build that awareness, to build that brand. And I'm not accusing healthcare marketers of using those incorrectly, but I do think there's opportunity certainly for us to take a look at some traditional marketing assets in the same way that Brightview has done. And then we talk about in growth hacking using the scientific method. Sean Ellis, I think, coined the term growth hacking. And so isolating a variable, postulating a hypothesis. I think if we do this, then here's the result we'll get, and then testing it. And the nice thing about Brightview is, like I said, our patients are not consuming a lot of media. They're not active on a lot of social platforms and so on. And so we are able to then isolate and say, all right, well, on this population, let's try a direct mail piece. Let's target this specific type of home. Boom. Let's target this specific type of mailbox instead. Boom. All right. Let's use call tracking metrics. Let's look at a specific URL, those types of things to gauge the level of performance that direct mail piece had. And again, the objective is to build awareness. So is search volume from that area going up? Are phone calls from that area going up? Not necessarily are new patients as a direct result from that direct mail piece increasing, but generally are overall activities rising? Because if they are, that means we did a good job building awareness. And then we're able to sort of compare the two. But I think isolating that variable, postulating a hypothesis, you have to know what you're testing against, what does success look like, and so on. At least I've certainly found that to be the case.
Yeah, I think that's really smart when it comes to just overall taking the big picture of testing, right? Because you have to test to know how your audience is behaving, right? And I think with traditional marketing, as you mentioned, it has its place, right? But you also have to understand your audience behaviors and where they're most likely consuming this information. And if it's not radio, right, like if they're not in their car, why spend thousands and thousands of dollars on radio? And when you think of that too, it's like these traditional marketing strategies they still work in a sense, but they cost a lot more versus a mailer, or maybe even when you think of like online marketing, if you're not using Google Ads, you rank it from an SEO perspective, like that is free traffic. So you just have to really weigh those overall concepts of your budgeting for marketing purposes, how you're going to target that audience based on the behavior, and then also like testing, like what is effective with where your audience, where you're going to meet their pain point. I think is very important.
That's exactly right. Understanding your audience's pain point is absolutely paramount. And so many times healthcare marketers, and I was guilty of this, I will raise my hand and say, I made this mistake early in my career. We tout the medical school that the physician went to. We tout their residency. We tout their fellowship. We tout their credentials. We tout the boards that they're a member of, the organizations that they belong to, or that they chair, or what have you. Patients don't care. I could take a printer and print off medical degrees from the best universities and fellowship certifications from the best universities and hang them on my wall.
Right.
And I could treat patients. And if I make the patients feel better, and if I help the patients to feel good as I'm treating them, right, and not just physically, but also emotionally, I'm not a doctor, right? And I could have fake credentials. Patients, generally speaking, I would say probably 99% of the time, are not vetting a physician's credentials. There's this old joke in medicine that is, what do you call a medical student who gets C's? You call them doctor, right? And that's true, right? Patients, as long as the physician is good at what they do, and it doesn't have to be a physician, we'll say medical provider, as long as they're good at what they do and they do a great job with patients, good bedside manner, good follow-up, all that stuff, I think as healthcare marketers, a lot of times we're focusing on the wrong thing. It's
Right.
not who the physician is, it's how the physician makes you feel, both physically, if you're hurt, if you're sick, what have you, and then also emotionally. And we've seen that to be very
Right.
true at Brightview. We don't really tout our providers' credentials. We make sure that the patients understand, hey, when you come in, it's a discrete outpatient setting.
Yeah.
When you come in, it feels more like an urgent care and a primary care practice than it does, a concrete dungeon like so many addiction treatment practices
Right.
feel. And that you'll get medication same day, you'll feel better today, we'll help you start managing withdrawal today. That physical side, the physiological side of biologically feeling better, of having that neurological and physiological stability. And then also, we greet you with a smile. We make
Yeah.
sure that we're helping you meet your needs. One of the first questions that we ask when folks show up to Brightview is, do you have a place to stay tonight? And do you have transportation here tomorrow? Because if they don't have
Wow.
either of those things, the likelihood of them showing up the next day is almost zero. So we
Right.
help them address those two concerns immediately, which means they're not leaving desperate and anxious and scared. They're
Right.
leaving knowing, okay, I know where I can go and lay my head that's safe tonight. And I know what time somebody's picking me up tomorrow to bring me to Brightview. So both of those factors, I think, are absolutely crucial. Not to say that medical school is not important, not to say
Right.
that residency and fellowship are not important. They certainly are. They help
Right.
inform that bedside manner. They help inform that level of care, certainly. But do they matter to your patients as much as other factors? And I would say the
Right.
likelihood is probably no.
Yeah, I think to that whole, like, you eloquently said that in a way where it's like that is customer experience, that's patient experience,
Exactly.
and making sure that they see that you care. And I think that's so important if you're running a business, right? Like if you're in the business of helping people, show them that you care. It's not just, I'm collecting, a check, or I'm here to solve somewhat of a problem. I have a bigger vision of, if I help this person, what if they can help someone else, right? And I think what you guys are doing, asking those type of questions, really showcases that you care. And I think that's critical. When we talk about customer experience, we can also talk about consumer or customer market or consumer marketing. Why is that so important now? Why is that that trend increasing, from your point of view?
That's a great question. So I think it comes down to several factors, and I won't pontificate on why these have come to be, but there's a lot of private equity money now in healthcare. And what that means is specialty practices are popping up in various, both metropolitan and rural areas across the
Yeah.
country. So whereas you may have had one dialysis clinic in your neighborhood, now you might have two or three or four.
Right.
Whereas you might have had one orthodontic practice in your neighborhood, and now you might have three or four or five, right? And you can go
Right.
through the list of providers, and that means patients have choice. And there's nothing that defines consumerism, in my opinion, more than choice. And so what that
Yeah.
means is now patient outcomes are very important. Having the
Yep.
data that says if you come here, you'll get better, you'll feel better, and here's the long-term data, that's really important. But reputation management is crucial, because
Yes. Oh
now
gosh.
you're being stack ranked by Google against everyone else within 5 miles of you who does the exact same thing you do, in some cases
Yep.
maybe better than you. And so, you mentioned patient experience a few minutes ago, Lamar. That's exactly right. Where Google is really good at vetting your patient experience, because
Oh
they
yeah.
display reviews front and center on your Google My Business listing. And so
Right.
reputation management is now crucial. And in healthcare, it's so challenging, because not only do we have to worry about GMB and then Yelp and some of the traditional review platforms, we also have
Right.
WebMD, RateMDs, Health Grades. I mean, you
Right.
go through the list, and all of a sudden there's this dispersion of reviews that makes it very difficult to build traction. So as we consider consumerism, we have to think, where are they going for their information? In my opinion, Google is paramount. They own
Right.
almost 90% of search volume, at least
Oh
in the
yeah.
US. And so for us to look at that and say, okay, as consumerism is increasing, I need to be making sure I'm managing my reputation in an intelligent fashion,
Right.
proactively. That can be done through a net promoter score system. So you're making sure that patient experience is really good. That can be
Yeah.
done through just using Google essentially as your NPS. But Yeah, that's absolutely paramount. The other thing is that consumerism is driven a lot of times by brand. So
Right.
and we talked about branding versus direct response marketing a little bit earlier, so I won't belabor the point too much, but that means that you are coming into a market where you may be the most reputable, the first choice, the optimal provider, but you may also be third or fourth in the
Right.
same neighborhood, right?
Oh yeah.
And so that creates a challenge where you're then trying to bolster your brand equity against some of the competition where maybe before, maybe 5, 10 years ago, you didn't have to worry about that. You were the
Right.
one dental practice within 5 miles of
Yep.
your customer base. And so,
Right.
yeah, you wanted people to have a good experience, but if they didn't really matter that much. Yeah, you wanted them to have good perceptions about you and you wanted to be reputable. But if you weren't, it didn't matter that much because they had to drive past you to get to your competition.
Yep.
Now that's less and less the case.
Right. Yeah, I think with reputation management, and this is why we offer this as a service from a digital marketing standpoint to all our doctors, is because it doesn't matter how many leads we send you, whether that's through SEO, Google Ads, or Facebook ads. If your reputation doesn't stand out and they see you have a 3.0 rating with 50 reviews and half of them are just poor conversations of your patients not happy, then we can send you patients all day, but they won't convert because they
Well,
don't trust
and
you.
to your point about conversion, gone are the days when you could put a call us now and schedule button on your website.
Yep.
Patients want convenience. And so
Yep.
if you don't have an online scheduling tool or some sort of online scheduling plugin, you're probably losing, my estimate would be 30 to 60% of your prospective conversions. That's absolutely paramount. We've seen that at Brightview. One of the first things that I did when I got here and started running marketing for Brightview was build out an online scheduling tool because
Oh, wow.
referral partners wanted it, community partners wanted it, and
Right.
patients wanted it. It's so much more convenient, and I hate to blame Gen Z or anybody like that, but half the time we don't want to talk to a person. Like I want to
Right.
be able to look at my calendar on my phone and figure out what's best for me and schedule it right there rather than having somebody on the phone say, what does Tuesday 8 o'clock work for you? Oh, it doesn't. What about Tuesday 9 o'clock? Oh, that doesn't. Okay, what about Tuesday at
Yep.
11 o'clock? Like that's inefficient and inconvenient. It's just so much more simple to schedule online. And
Right.
again, if you're not offering it and there's somebody else within a couple of miles of you who has a solid reputation, who has a good brand and may offer it, ooh,
Yep.
it's challenging to play second fiddle.
Right. It's a toss up at this point, and I think it's so important to really reiterate that, because a lot of our dentists and even new dental practice that we bring on, we talk to them about local med, and because we're niched in, niched in the dental space. Local med is a software that it's probably the only one out there that integrates with their patient management system and all the different dental patient management systems, where they can see, the patient can go on the website, they can see the actual doctor's schedule, they can see what hygienist is available, the time frames. I mean, you can set restrictions on that tool where it's, you can only book hygiene appointments. But the point is, you can book your appointment, put your insurance information in there, and then show up the next day. And doctors love it. The ones that believe in and invest in it, where none of them cancel it, because they get so many leads and more higher conversions based on people just having convenience. To your point, and I think it's it's sometimes unbelievable that like a lot of the doctors will say it's too expensive. It's like $100 a month. I'm like, what?
What are you
You're
paying
missing
somebody
the
on an
point.
hourly rate to put people on hold and provide a bad experience?
Right. Exactly. Exactly. Well, Colin, this has been an amazing episode. Really delved into, just traditional marketing versus, your current or modern marketing strategies. Also, just understanding consumerism marketing. So I appreciate and really understanding kind of your stance on, collaboration and Brightview, and really understanding all the things that and the data points and how to really connect your audience to your brand through all the different marketing strategies and testing, and they're reporting on that data. But beyond all that, I think the biggest thing I've heard from this episode is really the value you really place within your culture of your staff. I think that I don't care what marketing strategies you're executing, if the culture and the staff are not bought into the vision of helping people, then your business is not going to be as successful as it can be. So appreciate you sharing all that. So if anyone wants to get in contact with you, I know you have a podcast, you're all over the place, getting your MBA, you're doing amazing things out there. How can people reach out to you?
Well, they can find all of the information about me that they want at rethinkmarketingpodcast.com. Again, that's rethinkmarketingpodcast.com. LinkedIn is my social media platform of choice. So you can find me, Colin Jeffries, on LinkedIn as well. The website links to my LinkedIn account as well. So pretty easy to find me, that sort of one-stop shop, if you will.
Awesome. And we'll include everything in the description of this episode as well. Again, I'm Lamar with MetaRank Interactive. This is Colin Jeffries. Thank you again for listening to this episode. We'll see you next time.
Lamar, thank you so much for the conversation today. I really enjoyed it and appreciate it.
Absolutely.